All right, this is a story that came out in the observerreporter.com, September 3rd, 2017. West Virginia drug czar wants rising death toll stopped. And we know right up there with Ohio, West Virginia has also been a big problem as far as drugs are concerned. The director of West Virginia new Office of Drug Control Policy starts his job on Tuesday. And he wants to get out into the community to see what they're doing and to offer the state's help in fighting the opioid plague. Jim Johnson tells Charleston Gazette Mail that one of his first priorities is to halt West Virginia's rising death toll from prescription drugs. The answers are going to be in communities, Johnson said. The closer you are to the problem, the more you're going to know about it, and that's where the answers are going to be. West Virginia has the nation's highest drug overdose death rate, with 41.5 deaths per 100,000 people in 2015. State health officials say overdose deaths rose nearly 18% last year. The Office of Drug Control Policy is overseen by the Bureau for Public Health. Johnson was director of Huntington's Office for Drug Control Policy from 2014 until his retirement this year. During that time, partnerships were formed among multiple groups, including religious, medical, and nonprofit organizations and schools in order to combat the plague. And simply arresting people made Johnson realize that the problem wasn't going to be solved. I tell you what, that's how you solved it during the crack epidemic. It amazes me how arresting these people is just out of the question. But just remember all of the things that I told you about over the past few weeks. You have the girl that ran into a house and she killed two girls that were watching TV and injured their mother. You have all the drug driving accidents, and many of those are fatalities. I tell you, it's amazing how nobody should go to jail, but they were all for prison when it was the black community. These people are disgusting. As long as we had the demand we had, there was going to be a supply, Johnson said. Johnson said more needs to be done to get patients into long-term treatment for their drug addictions after they've been revived with the overdose reversing drug naloxone. Yeah, you know what the sad part is? During the crack epidemic, Narcan existed even back then. That drug has been around for a long time, I believe since the 70s. Did you see them Narcanning any crack addict? It's just amazing. It's always a different story when it affects them. Last year, after more than 24 people overdosed in 5 hours in Cabell County, a follow-up study by the state showed none of them got into treatment, and most of them don't. Many of them don't want help. They don't want help. They like being drug addicts. They like that euphoric feeling from the drug. Johnson said a key component for doing what will be teams that respond quickly to drug overdoses and getting law enforcement and medical community to work together is the only way to tackle opioid addiction. We've got a public health problem. With drug addicts trying to get money by any means they can by robbing and stealing and carjacking and breaking into pharmacies, breaking into homes, robbing banks. That's what you got. That's not a public health problem. A former Huntington police officer and interim police chief in law enforcement, we have the resources to cut the supply. But one way we know to cut the supply is to cut the demand down. Dr. Rahul Gupta, the state health officer, said a big reason Johnson was picked for the job was he understands opioids are a public health problem that hits every aspect of a community. He's the best. We're so thrilled to have him. Whatever, Gupta, okay? You still got a problem. And I don't care who you put into office and how much you try to cut down from doctors writing prescription, as long as the illegal drugs are out there, you're going to always have a problem, period. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.